couple exercises you can use in progression to help you increase your range of motion and re-educate the lower leg so that it sits more neutrally as you're moving through your gait. So, tibial torsion can be assessed by if your knees are facing forward, if you find that your foot tends to be pointing out at an angle, it can indicate that there's a torsion or a twist in the lower leg. So they label that tibial torsion. So if that's the case for you, these are a couple of exercises that you can do to help re-educate that lower leg to sit more neutrally. I would caution you that if at any point while you're trying this, if it creates pain, I'd like you to stop. And it's always a good idea to check with your primary care provider to see if this kind of exercise is appropriate for you. Okay, so let's talk about this. So we want to make sure that the upper leg isn't involved in this movement. We also want to make sure that the ankle isn't doing the work for us. So to do that, we're going to brace against the non-moving leg. For me, I'm using my right leg to demonstrate. You can mirror this for your left leg, or if you need to alternate to work with both legs, that's what you want to do. So bracing with that non-moving leg and the inside arm. And then I'm going to take the outside arm and I take my fingertips and I'm going to slide just behind the kneecap down towards the floor until I find a bony protrusion. So this little bone that sticks out of the side here is the very top of your fibula bone. We're going to use it to just make sure that the lower leg is doing the turning. So as a test, when you have that bony protrusion on your finger here, we're going to move the lower leg and you should feel that bone moving. Okay? So once we have that, then I want to make sure that the ankle isn't cheating for us, okay? So in order to do that, I want you to have even pressure on the big toe and the little toe. So you can make your foot go farther out by lifting the outside toe, but that's not helping you. That's just letting that motion go to the ankle. So keep that outside toe down. And the same as on the inside. We could go a little farther if we lift that big toe, but that's not going to help us with the tibial torsion, okay? So we're going to just use the arc that's available to you while keeping those outside edges down, okay? So this is the first exercise. I'm keeping weight on this foot, weight on the heel. I'm not pressing down on it, but I'm just letting the weight stay there. I'm going to rotate out, feeling that bone move on the outside. I'm going to hold this for 2 seconds, and then I'm going to rotate in. And I'm going to hold that for 2 seconds. Rotate out, 2 seconds, rotate in, 2 seconds. So each of those, we're going to call 1 repetition. So outside, inside is 1 repetition. 10 to 15 repetitions is a good starting point for this exercise. Then we're going to progress, okay? So at that point, we're going to do an outside rotation. We're going to slide the foot forward. We're going to do inside rotation, slide the foot back. Outside rotation, slide the foot forward. Inside rotation, slide the foot back. Again, there's weight on my foot while I'm doing this. And you'll notice my heel is moving, but I'm not lifting it up high. I'm keeping the heel down low, but I'm just letting that heel swing, keeping the weight even on the toes. And as you become comfortable with this, you can let more weight come down onto that foot. Each of these is 1 repetition. So slide out, slide in, 1 repetition. So 10 to 15 repetitions. You can also do it backwards. If you were doing it this way, then make sure you do it the opposite way. Okay, so 10 to 15 repetitions, reverse 10 to 15 repetitions. And that would be all that I would do in a particular session, but then you can do that 2-3 times a day, and you'll notice that you're feeling an activation in that lower leg, and it's re-educating how your body can move through space. Let me know how it goes.